Welcome student. I am Mr. Abhijit Bambre, working as assistant professor at Gokhale Education Society's Arts, Commerce and Science College Jowhar. In last video, we are discussed drugs for a respiratory system. What is a respiratory system? It is a system. It is a respiratory system. It is a biological system consist of specific organ and structure used for a gas exchange. It is an important biological system in an animal as well as in an plant. Main function, as we know, main function of respiratory system are allowed to talk and to smell, right? Allow you to talk and to smell, then bring air the body temperature and moisturize it to the humidity level that body need or that level you need, right? Then deliver oxygen to the cell in your body to remove gases, unwanted gases including carbon dioxide. In simple, respiration is lung ability to eliminate carbon dioxide and to take up oxygen. In last video we discussed respiratory drug or drugs for respiration system, that is expectorant. What is expectorant? It is a Latin word. Expector means to drive out from the chest or throw out from the chest. Then classification of expectorant drug, that is sedative expectorant. They are sedative and stimulant expectorant. The further classification of sedative expectorant are saline expectorant, nascent expectorant and demulsion expectorant. And stimulant expectorant classify into two types, that is direct stimulant and reflex stimulant. So student, today we are going to learn another respiratory drugs, that is mucolytes, bronchodilator, decongestant and anti-tissue. Let's move. Respiratory system. Respiration is an lungs activity to eliminate carbon dioxide and to take up oxygen. Respiratory activity is subjected to a variety of chemical control and non-chemical control, right? Then respiratory insufficiency is either due to ventilator failure or oxygen failure. Then prolonged bronchial narrowing and their obstruction by secretion are responsible for ventilatory failure. Obstruction means blockage. Then non-chemical control such as joint movement, temperature, blood flow, irritation of respiratory passage, vomiting, swallowing are the factor that alter the rate of and depth of respiration. Respiration is biological activity. It is very important system. Respiration main function to take up oxygen and eliminate carbon dioxide, right? Next, respiratory drugs for respiratory system. They are classified into 5 types: expectorant, second mucolyte, bronchodilator, decongestant and anti-tissue. In last video we discussed about expectorant. What is expectorant? Expectorant word, it came from Latin word, that is expectorer, means drive out from the chest. Expectorant are the drugs which increase the production of demulcent respiratory tract fluid that cover and protect the irritated mucosa. Or the expectorant drug are useful in the treatment of cough due to irritation of respiratory mucosa below the epiglottis. You know epiglottis, that is it is an flap made up of cartilage covered with mucosa. Expectorant are classified into two types, that is, first one is sedative expectorant and second one was stimulant expectorant. Sedative expectorant are further classified into saline expectorant, then nascent expectorant and demulsion expectorant, and stimulant expectorant are classified into two types, that is direct stimulant and reflex stimulant. Expectorant, in last lecture we discuss or we learn expectorant. What is expectorant? Their classes and subclasses of expectorant and their function of expectorant. Actually, respiratory system mainly consists nasal activity, oral, epiglottis, tonsil, pharynx, larynx, trachea and lungs. Next, bronchodilator. What is bronchodilator? Bronchodilator are small branches of respiratory tract, and the narrowing of bronchi is brought about by blockage by viscous mucus with bronchial lumen, then infiltration and edema of the bronchial mucosa. Infiltration and edema. Edema means a swelling due to bronchial mucosa, then spasm of involuntary smooth muscle around the bronchi. Spasm means a sudden involuntary muscular contraction. Spasm means involuntary muscular contraction. Then inflammation means swelling of bronchi by bacterial infection. The narrowing of bronchi is brought about by four main reasons, that is blockage by viscous mucus with bronchial lumen, second one infiltration and edema means swelling of bronchial mucosa, third one spasm means involuntary muscle contraction of muscle around the bronchi, then inflammation of bronchi by the bacterial infection. Bronchodilator are the drugs which are used to open up the narrow air passage by dilation of bronchi and bronchiole, and thus they facilitate breathing process. Bronchodilator are drugs which are used to open up narrow air passage by dilation of bronchi and bronchiole, and thus facilitate the breathing process. Facilitate or increase the breathing process. They help to relax the smooth muscles around the bronchi and thus help to diminish bronchospasm. Diminish means to decrease. Next, decongestant. What is decongestant? Decongestants are excessive secretion in the gland of nasal and paranasal area, lead to accumulation of fluid and thereby causing a nasal obstruction and even inflammation. When excessive secretion of gland of nasal and paranasal area lead to accumulate or accumulation of fluid and thereby causing a nasal obstruction, means blocking and inflammation, thus the vasoconstriction of nasal capillary bed is brought about by a activation of local alpha adrenergic receptor. The nasal secretion get reduced, resulting in clearing of the air passage. In such a condition, when excessive secretion of gland of nasal and paranasal area lead to accumulation of a fluid and it cause a nasal obstruction and even inflammation. Decongestants are drugs to clearing the air passage in such a condition. Decongestants are a chemical agent which reduce the accumulation of fluid due to excessive secretion. They are reduce accumulation fluid due to excessive secretion from nasal and paranasal gland and clear the air passage of obstruction and reduce any inflammation. Thus, the drugs are normally used in common cold and sinus infection. Common cold and sinus infection. Sinus is an cavity around the nasal passage, or sinusitis is an condition in which the cavities around the nasal passage become a inflamed. Means swelling take place in nasal and paranasal gland or in an sinus. There are two type of sinusitis, that is a acute and chronic. Acute can be triggered by a cold or allergic condition and may resolve on its own, while chronic condition last up to 8 weeks and they may be caused by a infection or some growth problem. Or those or decongestants are those drugs which are used to reduce accumulated fluid due to excessive secretion from a nasal and paranasal gland, and they clear the passage of respiration. Next, decongestant, local decongestant and systemic decongestants. They can be locally applied or as a nasal spray or nasal drops in a children. They given through the nebulizer. They are actually local spray, nasal drops, and in children through the nebulizer. They have shorten action duration. They have short action duration. Ephedrine and norepinephrine are used as decongestant. Is a most favored decongestant as it has high potency and does cause a CNS depression. High potency means in lower dose it gives high desired effect. It means a drug potency is known as minimum drugs give maximum desired effect. Systemic decongestant, in case of severe congestion and blockage of sinus, the decongestant is administered by the infection. It acts faster and long acting. Local decongestant is a short acting decongestant, while systemic decongestant is a long acting and fast acting decongestant. Side effect of systemic decongestant are nausea, then anorexia means eating disorder, then urinary retention means difficulty in urinating. Next, anti-tissue, irritation of respiratory tract at various sites such as pharynx, trachea, bronchi produce tussle impulse. Tussle impulse or tussles is a sudden noisy impulsive of air from the lungs. Is an condition. Tussle impulse is a condition, a sudden noisy impulsion of air from the lungs called as tussle to produce such a expulsion of air. Dry cough without expectorant. Cough is thus a protective reflex which help to expel irritant or obstructing matter from the respiratory. Anti-tissue are agents which depress the area in the central nervous system which control the cough reflex. Then, thus the result in the suppression of cough, and hence they are called as cough suppressant. Anti-tissue are drugs which are called as cough suppressant. Drugs for respiratory system, in that we are discuss expectorant, mucolyte, bronchodilator, decongestant and anti-tissue. Mucolyte, expectorant means throw out from the body. Then mucolyte is drugs or respiratory drugs classes of drugs which aid in the clearance of mucus from the airways, like they are used to clear the mucus from the airways. Mucolytes are drugs or drugs from a respiratory drug class. They are used to clear the mucus from airways like lungs, bronchi and trachea. Example of such drugs are carbocysteine, then bromohexine and mannitol powder. Then bronchodilator. What is bronchodilator? Then decongestant and anti-tissue. Bronchodilator are drugs used to open up narrow air passage by the dilation of bronchi and bronchiole, and thus facilitate the breathing process, and they help to relax the smooth muscles around the bronchi and thus help to diminish bronchoplasm. Then decongestants are drugs which are used, or those are chemical agents which are reduce the accumulation of fluid to excessive secretion from nasal and paranasal gland and clear the air passage of obstruction, means blockage, and to reduce any inflammation. Then anti-tissue are cough suppressant. Drugs for respiratory system, there are 5 drugs for respiratory system, mainly expectorant, then mucolyte, then bronchodilator, fourth one decongestant, and fifth one anti-tissue. Expectorant are drugs which are used to throw out the cough or phlegm. Then second one mucolyte are drugs or that class of drugs which are used to clear the mucus from the airways like lungs, bronchi and trachea. Example of mucolyte is bromohexine or carbocysteine. Third one bronchodilator. Bronchodilators are drugs which are used to open up narrow air passage by dilation of bronchi and bronchiole, and they facilitate the breathing process. Bronchodilator are drugs which are used to open up the narrow air passage by dilation of bronchi and bronchiole, and thus they facilitate the breathing. Bronchodilator, they are drugs used to facilitate the breathing. Next, decongestant. Decongestant are drugs or chemical agent which reduce the accumulation of fluid due to excessive secretion from a nasal and paranasal gland and clear the air passage of obstruction and reduce inflammation. And anti-tissue are drugs used for respiratory system. They are cough suppressant. Thank you.